up today, a special Valentine's edition of All Things Heart. Love is in the air. Meet the medical providers caring for heart patients who fell in love, joined their own hearts, and are now married. Good morning, I'm Jessica Lovell in for Alexis Del Cid today. Welcome to a special Valentine's Day edition of All Things Heart, where we are wrapping up our week of love. Today we meet a man and a woman who have a place in each other's hearts. They both work in cardiology and met in the procedure room.
Good morning.
Good morning.
Give me a big breath.
Take a big breath for me.
You never know when or where Cupid's bow may strike. The love story for these two doctors, both specializing in matters of the heart, began in a procedure room years ago. Gina Doonan was an RN before she earned her Doctor of Nursing practice degree. Cardiologist Dr. Aaron Doonan was beginning his fellowship training.
I don't think he was very impressed with me at first because I was pretty hard on him.
But over time, those first impressions faded, blossoming into a deep friendship.
I don't know if there was a first move made. I think it was more just we talked a lot.
A slow burn ignited.
It's easy to be able to talk to somebody and they understand what you're talking about.
And it grew into love.
He actually proposed to me on Valentine's Day.
And their prescription for keeping the romance alive is one we could all follow.
She gets up at 4:30 in the morning and I get up about 5:15 to start her car and get her out the door with the coffee.
It's the little things throughout the day, even if it's just a quick hey at lunchtime to see how your day's going.
They are intentional when it comes to carving out time to connect.
This past year we've taken up cooking together, so we try to make, TikTok or Instagram recipes, some of which work out and some of which don't. But for the most part, it's kind of a fun endeavor.
We do try real hard to have dinner every day.
Those family dinners do come with side effects for their two kids.
They've both declared that they have no interest in medicine.
The kids are not interested in medicine at all. I think they've suffered through too many stories at the dinner table.
When we ask each of them what their message would be to the other on Valentine's Day, Gina goes for the sweet.
He's really funny. Our kids give him a hard time because he has a lot of dad jokes and he has such a sweet, soft side.
Her husband goes for the cheese.
Gina, you are the heartbeat of my life and you keep my world in rhythm. You don't need a stethoscope to hear my love for you, and I just wanted to say happy Valentine's Day, baby.
You're using all the cardiology terms there.
She's gonna roll her eyes. And I don't blame her. By this time, she's used to it.
And Gina Doonan with us today. Is he just kind of a cheese ball like that?
Kinda.
Okay, that's okay. We love that about you.
I'm sweating now, thank you.
Okay, good. Okay, so we got our eye rolling for the morning, but that's good. So good messages to each other. We're also joined today by Dr. Jessica Hamilton, clinical psychologist with the health system. Good to have you.
Thanks for
You're
having me.
gonna help us kind of explain, how the mental and emotional side of this all works, and really the benefits of having a stable, loving relationship and partner in your life can really help, especially when you're in a high pressure field like these two are. And because of this being their personal story, you both have given us the blessing of not calling you doctors today. We usually always call our doctors because you have certainly earned it, but we are going to call you Gina and Aaron today, so thank you. So Aaron, sounds like you met in kind of a high stress scenario as doctors. So what was that like?
Well, the cath lab is always stressful. There are many critical things going on at that time, so we're all sort of high-strung, but we also like to have fun outside of work. And so, when we met, of course, we were working together, seeing patients, but then there were a lot of social things after work that we could go do, and we sort of grew out of that.
I see how you work. Okay, so Gina, you mentioned you were kind of hard on him in the procedure room. What do you mean by that? Were you kind of all business?
Oh, yes.
As you should be.
Absolutely. I think because I'd been a nurse for so long before I had transitioned, and I was hard on every fellow in training.
Yeah, nurses don't mess around.
Yeah, no.
Yeah. Did you think you'd meet your person this way, though?
No, not really. I didn't, but he He grew on me. I don't know.
You grew on her. So do you remember it this way? How do you remember it?
Oh, I clearly remember this
Okay,
because she
tell us.
called me to come do something that I didn't want to go do. And she said, well, you're going to come do it. And I begrudgingly had to go over and go do it. And that was sort of my first interaction with her. And I was like,
All right.
fine.
Fine, I'll do it. All right.
Because I don't want to get in trouble because I'm a trainee.
Yes, I like this.
So,
I like
yeah.
the dynamic.
Oh, I
shift
remember
here.
that clearly.
So, did you ever, reconsider dating somebody in the world of medicine? I mean, we know this is a high stress, high pressure world. Was it like, I am not, like your kids said, they don't want to get into medicine, they want nothing to do with it? Were you ever thinking that when it came to your personal lives?
I was not. I think we weren't certainly looking for anything at the time, and it just, like I said, happened very organically, and that was kind of the appeal of it all.
Organic, Gina?
Yeah, I would say so. I mean, we were friends for years before we really started to think further than that.
Yeah, yeah. So, Dr. Hamilton, as we mentioned, you're here to help us understand just how that having a real solid, stable relationship can help in the mental impact that it can have. So tell us how it helps with coping with life's challenges, having like that solid partner with you side by side.
Well, I think that anytime you have somebody that you can openly communicate with, it just allows you to kind of debrief from your day, to calm yourself, and it can actually have this like feeling of release, right? It can be cathartic. Actually.
That's what I was going to say. Is there something like chemically happening in the body?
Absolutely. So if we think about like cortisol, which is a stress hormone that we actually manage, it's highest at the beginning of the day. It's supposed to naturally go down. I have no idea what your cortisol levels are doing, guys.
Well, right now they're really high.
And it's morning, so it's like double down effect.
Oh, gosh.
But in general, working in medicine, working in a high stress environment, you can get something where your cortisol doesn't fluctuate as much. It's this like inflexibility that can occur. And that can have really long-term negative effects on your health, not just emotionally, but even physically. And so having somebody that you can go home to and decompress, that understands what you've been through and can relate to the dynamics of what that stress looks like and help you kind of unpack it, can really help with allowing that flexibility to kind of resume in that stress hormone, in that adrenal gland.
Well, and we know in a lot of couples, when you don't work in the same field, you come home and you're kind of like, it's like white noise. You hear them talking about their jobs and you're like, okay, and you kind of pretend to be interested. With you guys, you speak the same, okay, I have no idea what you're talking about. But with you guys, you're speaking the same shorthand. Do you think that helps, that you both know exactly, like I know what you're talking about?
Oh, for sure. I don't know if you've ever been at a party with a bunch of medical professionals.
I bet that's
and
fun.
people who are not medical professionals, they're always tuning out. So, and the fact we do work in the field and we know each other's job very well is very helpful. It is cathartic at night when, I guess when the kids aren't around because they aren't interested, but we can talk about things in depth and in very high detail and sort of come to some solution or at least understanding about what we're dealing with, and that's very helpful.
Gina, when you've been through something stressful or had a long week, just one of those weeks, are you intentional about trying to find ways to decompress and lower those stress levels together?
Yeah, I would say we are. I think even kind of going back a little during the day, if you're having a bad day and you're able to just reach out and spew something via text, it helps, because I know when he eventually can read it, he'll understand and probably reply with something that will help me feel better. And that's really useful.
And I think it's not just necessarily the stress of your patients and the job that you're necessarily doing, but it can sometimes be the interplay between the fellow that you're working with that didn't come do the procedure, right?
Exactly.
And the frustrations and the dynamics that can go along, and that you find in any workplace. So it's nice to be able to decompress about the stressful patient or the thing that happened, but it also can be really nice to then also have somebody that's just emotionally supportive of the stress that you may be experiencing.
Right, the fellows that you don't feel like falling in love with can be very frustrating, right? Yeah, exactly. They're not-
Fortunately, there weren't many of those.
That's very good for you. Yes, there's a numbers game. I like that. Are there mental health risks for couples in high stress professions? I mean, it seems to make sense, but I mean, is that true?
Well, I think that anytime there's a lot of stress in the dynamics between a couple, that's a recipe for not allowing that cortisol level, like we talked about, kind of come down naturally. I also feel like you have to have a balance. If you're in a stressful position, you need to have that balance, and that can come from the dynamic in your partnership, but you can also look for ways of coping and de-stressing within yourself too. So it doesn't have to just be in a relationship. It can also be something that you're finding and looking for ways of coping independently as well. And I think that when people work together, sometimes it can be really hard if you're together all day and all night to find ways of separating, and then that can also create some discord within the couple. So finding that space and that time to have you time as well as couple time and then professional time, and setting some of those healthy boundaries in the relationship. Like, I love the fact that you guys cook together. I think that's adorable, and it's not related to medicine.
Yeah, that
Right?
makes, yeah.
It just makes you a human,
Yeah.
right? But then also finding ways of, whether that be exercise, and you can do that together, you can do that independently, having your own hobbies, those types of things can also be really helpful.
And when we're talking about stress, I mean, nothing more stressful, as we can imagine, as the time of COVID, going back 5 years. What was COVID like for you all? I mean, certainly you deal with it all day, and then you have to come home at night.
Yeah.
What were those conversations like? How did you manage that?
Well, they were brutal. At the time, I was doing a lot of ECMO at my previous job, and it wasn't pretty. Everybody was very, very sick, and
So you
it
were
was
very
high
face-to-face.
acuity. Yeah, and you can't get away from it because you're the one treating the patient, and so that was very hard on me. And she knew it, but she was there for me, and that was very helpful. So, but COVID was tough, just for that reason for me.
Yeah, Gina, that's a different type of stress. I mean, a spouse comes home, a partner comes home, and you've had a long day. COVID was different,
It was.
especially a spouse who's on the front line like that. How did you help?
Listen, a lot of listening. I managed the kids a lot then too, because he wasn't around as much, and just honestly, it was just a lot of listening, because there was nothing I could do to make it better other than listen and be there.
Yeah, kind of everybody holding on for dear life.
Yeah, like
Yeah.
listening and then validating what
Yeah.
he was experiencing. And then I also heard you say, like, you kind of changed your guys' like normal, typical balance in your relationship of you taking more responsibility with the kids to allow you to do the work stuff and to be a more emotionally supportive, where on your normal homeostasis outside of COVID time is a little bit more balanced.
Exactly.
Yeah.
And we have to be flexible with our partners.
Makes sense. Okay, if you have questions, send those on YouTube, Facebook. You can send them to the All Things Heart email. You can find those links right there on your screen. Okay, Gina, before we go any further, you are a DNP, Doctor of Nurse Practicing. Explain for folks who are non-medical, who are watching and listening, what is that?
So there's a few options when you become a nurse practitioner. You can become a master's, but regardless, you're still a nurse practitioner. I chose the Doctor of Nursing Practice because I wanted to be the highest level of my career path that I could go. And it doesn't necessarily change how I function as a nurse practitioner. Nobody actually calls me doctor, and that's okay. But it allows me to practice, and I can still do research and further education. I could go teach.
And what do you love about working with the heart?
It's just what's always been intriguing to me. So the funny thing is, when I was in nursing school, I hated cardiology. But then when I graduated, there were only a few options available when I had graduated, and so I chose cardiology, and I've never left. So.
All right, and since we have two very highly accomplished heart experts here on our program, we have to talk a little heart health. So we're going to grab some expert advice. So what are some of your top health habits, diet-wise? Gina, I'll start with you.
Well, I think consistency is always best, right? So we try to limit how much red meat we eat. We try to include our vegetables, and just portion.
Aaron, any do's and don'ts for you?
Well, I always tell my patients everything in moderation. So, you know, it's not good to eat bacon every day. You probably shouldn't have an omelet every morning, you know, things along those lines. And for the most part, I think we adhere to that. It gets a little harder when you're at the lake enjoying, you know, the summer, but for the most part, I think we do a pretty good job at that. You know, I guess we'll see as time goes on how well we've done.
Do you get out and move together, activities? What do you like to do?
Yeah, we spent a lot of time in the past running. And, you know, as I've aged a little, some joints don't react well to that anymore. But we still exercise. We've taken up this thing called rucking, where you put some weights in a backpack and walk around with it, and it's supposed to be good for you. Yeah.
Okay.
Popularized by Michael Easter, who actually saw it at a KU conference. But anyway, so we started doing that until the blizzard recently.
Yeah, right. And then Dr. Hamilton mentioned you all cooking together. She's loving that. How has that helped bond you? And I would imagine you bring the kids in on that too, which is great.
We try to. We started off, there's a guy that loves butter and cream, and so of course those recipes tasted great, but you know, weren't so great for you. So we've morphed into something that's a little better for you. Yeah. But it's fun to learn new techniques and buy spices you've never heard of before. And use those.
Experimental.
So that's fun.
And Dr. Hamilton, how great is that though? And how does that help? Again, bringing those cortisol levels down and just connecting.
Well, both the exercise as well as the cooking, they're very different areas of your brain, but they're also not related to stress necessarily. Although I will say, you can get stressed out cooking.
Oh, that's
but
happened.
But very different and in a fun way. And we just enjoy, I love cooking as well and exercise, and it's one of those things where it's releasing the stress of the day. It's letting it just kind of like seep out of your body and kind of recentering you. So it's just a healthy way of letting go.
What's your take on alcohol? A healthy glass of wine? Red wine, yay, nay?
Well, they used to recommend it,
I hope they
but it's
still
kind of
do.
like doctor smoking. I think as we
We're gonna
learn over
later.
time, it's probably not all that
Oh
great.
gosh, I hope it's much later.
Yeah.
Okay.
So, but we still believe in the power of wine.
Okay, the power of wine. Okay, again, in moderation.
In
right?
moderation.
Absolutely.
Okay. So, Dr. Hamilton, you know, just kind of as we start to wrap things up and get to some viewer questions, just what if people are really wanting to, maybe they've been disconnected for whatever reason in their relationship. If they want to take some first steps to try to reconnect, where would they start?
Communication, you know, just the desire. And a lot of times over the course of a relationship, it's really easy to start thinking about and seeing the things that you're not getting rather than the things that you are getting out of the relationship. And we can get very cynical and resentful. And so I really like to start with just communication and kind of just like challenging the negative with positives and affirming the things that you are getting out of that relationship and the things that your partner is doing for you, as well as then finding an opportunity and a space to reconnect with an activity that you both enjoy, that are in line with you, with a together activity.
Yeah.
I find that as you're raising kids too, that can be a really stressful time because you're balancing and working and finding that space to kind of come back together. It can be a really exciting time in a relationship, actually. And so I love the cooking and the exercise and the activities that you guys are doing together. It sounds like they've done a superb job of navigating
kind of
a
raised the bar for everybody else.
Wow.
I know, right? Okay, so this is the highest to achieve to. Okay, okay, all right.
Ooh.
Right. Yeah, no pressure, no pressure. All right, we have some fun questions from our viewers, so I want to get to these. And I have to ask Aaron and Gina, are you Grey's Anatomy fans? Be honest.
Well, there's a story there too.
Okay.
I refused to watch it because it looked so fake to me. But then I was convinced we should watch it, and then we have watched it all. So yes.
How true to life is it? Is it a total escape for you? I take it.
I mean, it's just fun nonsense to watch,
Fun
right?
nonsense.
I mean, there is not much truth to it at all, but it's just mindless.
So there's no McDreamy, McSteamy.
No.
Well,
I mean, yes.
Yes. Okay. Yes. You found the one McDreamy.
Yes.
Okay, you got
He's
him.
McDreamy and McSteamy.
But do people keep their relationships secret? There's none of this. Like you said, there's no secret elevator
No.
things happening.
I don't believe so. If there are, they're still
keeping a good secret. Okay, they're keeping some really good secrets. Is there a show? Is there a medical show on that is at all similar to what you all go through?
Boy, we don't watch a lot of those,
know.
actually. So,
I know.
but we do pick up on things in other shows. We're kind of like, oh, come on, you know, like last night, somebody was dead, and they said there's no vitals, but nobody was doing CPR. We're kind of like, oh, come on, don't you have a medical consultant on the show?
Oh, see, I could see where you'd want to watch that, just to sit there and give commentary
Yeah.
on it
Yeah.
all the time. That,
Yeah.
that was so good. All right, so that was Marie's question. Jill wants to know how much you do talk shop. Do you like to talk shop, or does it get old at home, or do you sometimes just go, no, we're not talking shop tonight, let's just talk about something else?
No, I would say we talk shop a lot.
Yeah.
I don't know if we've ever tired of it, just because it's what we do all the time.
It's
And,
over, yeah.
So.
Cindy wants to know, as heart specialist, do you have any advice on how to mend a broken heart?
I think that's her department.
Okay, they're
There
just
we
passing
go.
it right on over to you.
I know.
Okay.
I know. Well, I feel like we kind of covered that a little bit of just like kind of trying to like be open to looking at the positives in the relationship and trying to rebuild. If you get to a place where you're really talking about, is this the right relationship for me? Then you've got a lot of reconnecting to do if that's the path that you choose to go down. And it's okay to acknowledge that it's not always the path that you might go down, and healing from within is also important too.
Jonas has a question. Have either of you had to make compromises or turn down opportunities to make your relationship work?
Not really. I mean, well, to be fair, when we moved to Kansas 12 years ago, I wasn't a huge fan. I was like, where are we moving? We came from Minneapolis, Minnesota, and so that was, I suppose, a compromise in a way.
That is, yeah.
Yeah.
How do you feel about KC now?
I love it now.
You love it now?
Yeah.
Okay, you got your red going. I
Yeah.
see it. I see it. Okay, good. Well, just last, I want to ask you just kind of your final thoughts, but anything that you want to share with us, Erin, I'll start with you, just about, just making connections, as we wrap up this Heart Week and connections and love.
Well, our relationship was a bit of a surprise. Like I said, we weren't looking for anything at the time, but we found something in each other that, has lasted, and we both enjoy it a lot. So I guess we were open to it, and it's worked out really well for us.
Gina, any last advice for connections, making connections?
I would say that it is work. You have to put the work in to make it work. And so, like she said, you have to have the connections, and that doesn't always come easily, and you just have to take the time.
Dr. Hamilton, wrap us up. Take it home. Give us some
Yeah.
really good
No
good
pressure.
advice to head into the weekend with. It's Valentine's Day, so
Enjoy the holiday if you can. Make sure that the time and communication, making it a priority, making your relationship a priority is something that has to be there in order for it to be sustaining, as well as the compromise. And don't forget to say thank you and express gratitude to your partner for the things that you notice that they do. I can't express enough how much that impacts your partner. And I remember in the video earlier, I think it was Gina that was like, it's the little things that, warming up the car and having that cup of coffee in the morning, those things do make a lasting impact on our cortisol level and our hearts. So just, be present and take the time and prioritize.
Thank you for your expertise. Thank you for your work with our heart patients, and really just thanks for sharing your story today. Getting personal, we like it. Thank you so much. And thanks, sir, for all of you for being with us today. If you would like to watch or share one of our previous episodes, you can scan the QR code to find a list of all of our shows. Also, February is National Heart Month. How's your own heart health? Have you ever asked that question? Some heart conditions have symptoms and others don't. So scan the QR code on your screen right now, and it will take you to our heart health quiz so that you can assess your own heart health. Have a great Valentine's Day and weekend, and we'll see you back here next week. Coming up Monday on the Morning Medical Update, a milestone for the first ever proton therapy center in Kansas City. I'm Jessica Lovell on the next Morning Medical Update. We celebrate 500 patients and counting who chose this innovative cancer care. Meet a man who didn't know it existed until his second opinion. Monday at 8.